Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Staff Nurse Previous Year Question Paper Part 6. Let's start. The first question. Which fluid cause shifting of fluid from cell to plasma? Option A. Hypotonic solution. Option B. Isotonic solution. Option C. Alkaline solution. Option D. Hypertonic solution. The correct option is option D. Hypertonic solution. What are the benefits of kangaroo mother care? Option A. It maintains temperature. Option B. It is helpful in breastfeeding. Option C. It increases the affinity between mother and baby. Option D. All of the above. The correct option is option D. All of the above. Vital test is done in the diagnosis of option A. Rheumatic fever. Option B. Hay fever. Option C. Enteric fever. Option D. Dengue fever. The correct option is option C. Enteric fever. Which of the following electrolyte imbalance is associated with digoxin toxicity? Option A. Hypokalemia. Option B. Hypernatremia. Option C. Hypernatremia. Option D. Hypocalcemia. The correct option is option A. Hypokalemia. The infant has undergone of VP, ventriculoperitoneal shunt surgical procedure. On the assessment, how will you access the sign of increased ICP? Option A. Respiration. Option B. Blood pressure. Option C. Anterior frontala assessment. Option D. Urine output. The correct option is option C. Anterior frontal assessment. Parkland formula for fluid calculation in burn patients. Option A. 4 ml into BSA into weight. Option B. 3 ml into BSA into weight. Option C. 2 ml into BSA into weight. Option D. 1 ml into BSA into weight. The correct option is option A. 4 ml into BSA into weight. Intermediate positive pressure breathing is contraindicated in option A. Comatose patient. Option B. Pulmonary edema. Option C. Asthma. Option D. Tracheoesophageal fistula. The correct option is option D. Tracheoesophageal fistula. Endogenous depression is also known as dash. Option A. Autonomous depression. Option B. Reactive depression. Option C. Bipolar depression. Option D. Unipolar depression. The correct option is option A. Autonomous depression. What is the ideal position during a lumbar puncture? Option A. Lateral recumbent position with knees flexed. Option B. Supine position. Option C. Lateral position with extra pillows under the head. Option D. Fowler's position. The correct option is option A. Lateral recumbent position with knees flexed. Give the correct order of 5 stages of dying people. Option A. Anger, depression, bargaining, denial, acceptance. Option B. Denial, depression, bargaining, anger, acceptance. Option C. Depression, denial, anger, bargaining, acceptance. Option D. Denial, anger, bargaining, depression, acceptance. The correct option is option D. Denial, anger, bargaining, depression, acceptance. Which condition is defined as the inflammation of the peritoneum? Option A. Duodenitis. Option B. Colitis. Option C. Peritonitis. Option D. Gastritis. The correct option is option C. Peritonitis. When caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? Option A. Turn the neonate every 6 hours. Option B. Encourage the mother to discontinue breastfeeding. Option C. Notify the physician if the skin becomes bronze in color. Option D. Check the vital sign every 2 to 4 hours. The correct option is option D. Check the vital signs every 2 to 4 hours. After birth of a baby, breastfeeding should be started. Option A, within 2 hours. Option B, within 1 or 2 hours. Option C, on second day. Option D, after 1 week. The correct option is option B, within 1 or 2 hours. The ratio of lung inflation of chest compression in cardiopulmonary resuscitation is option A 1 is to 5, option B 2 is to 5, option C 1 is to 3, option D 3 is to 1. The correct option is option C 1 is to 3. Which of the following conditions has an increased risk for developing hyperkalemia? Option A Crohn's disease, option B renal disease, option C chronic heart failure, option D end stage renal disease. The correct option is option D end stage renal disease. During resuscitation in an infant, ratio of chest compression and ventilation breath should be option A 1 is to 1, option B 1 is to 3, option C 3 is to 1, option D 5 is to 1. The correct option is option C 3 is to 1. A client with C4 spinal cord injury is at greatest risk for option A neurogenic shock, option B respiratory compromise, option C paralytic ileus, option D stress ulcer. The correct option is option B respiratory compromise. The microorganism that is usually a part of the normal vaginal flora but can cause meningitis in newborn is option A Corynebacterium species, option B Candida albicans, option C group B Streptococci, option D Staphylococcus epidermidis. The correct option is option C group B Streptococci. A pregnant woman diagnosed with severe anemia, HB less than 7 gm per dl, will be treated by option A advised to take food rich in iron and vitamin C, option B advised to take iron and folic acid tablet 1 OD for 1 month, option C packed cell transfusion, option D administer iron IM injection 1 OD for 1 month. The correct option is option C packed cell transfusion. All are the clinical features of meningitis except option A nuchal rigidity, option B poor feeding, option C high pitched cry, option D constipation. The correct option is option D constipation. Please like and subscribe. Thank you.